Do you breathe? I hope that you do. So if you breathe, you really want to do this assessment. It's fascinating for most people that I share it with. Now, if you breathe and you also happen to have a core and or pelvic floor issue, you really want to do this assessment. This assessment is awesome because it will show you if you have excess rib diaphragm tension, and it will show you if that's connected to your core and pelvic floor function, and you get a tool for how to handle it. So that's pretty cool. Take the test and see what you find. Let's do the before. Lie on your back, knees bent, feet on the floor. Arch your back a ton from your pelvis to your ribs. Now, stay here and exhale and only tuck your pelvis under you like you're crushing an egg in your lowest back. This is the area that I'm pointing to on my back that you want to be targeting. So not your lower back, not your middle back, but really just that lowest portion of your back. And do it again and again. As you do it, I just want you to notice what this action feels like. Does it feel hard, easy, sticky? Your core is firing, your core is hardening. Is your core bulging out? So let's do the corrective, and we're going to come back to this after at the end. Stay lying on your back, knees bent still. Relaxed completely this time. Spine is relaxed. Take your fingers now and find the base of your ribs. Start all the way at the sides of your ribs and sink your fingers into the skin and then under your ribs a little bit and massage that point for about 30 seconds. I really want you to massage very gently. Does it feel easy, tight, sticky? Can you get your fingers to sink into the tissue, or is the tissue very resistant to that? After 30 seconds, move your fingers inward towards the center of your body just a little bit, but still at the angle of your ribs, and find a new spot to massage. You will go the entire length of your ribs, 30 seconds, more or less at each spot, and just notice what you feel. It is very common for people to be extremely tight here, but ideally our fingers should just melt into that space, and that space should be soft and squishy. If lying down wasn't working well, come to sit in a chair. Place your fingers at the same spot, that outer ridge of your ribs, and try to just slide them inward and a little under gently. Again, notice if even just sitting here, you hit a wall of tension. It's okay if you do. I want you to curl your spine in a lot, rounding your spine so your body comes forward a bit, your spine is rounding, and this should make it much easier to slide your fingers inward and upward. Again, please don't be aggressive. There's no need. Once again, checking into what you feel as you trace the angle of your ribs from the edge to the center, stopping to massage gently at each point for about 20 to 30 seconds. If you have a lot of tightness and tension, or your fingers don't even sink, I would definitely say this is something to return to again and again. Let's do the after. Lie on your back, knees bent, feet on the floor. Arch your back a ton. And once again, like we did before, try to just tuck your pelvis under you a lot, like you're crushing an egg, like right above your butt crack, actually. Notice if this feels any different than before. Is it easier? Do you feel your core more? Is it easier to not bulge? Does your pelvis move more? What is the overall sensation now that you relax the area around your ribs and diaphragm? Be sure to read the caption for context on all of this.